good day everyone. Welcome to the Doctor's In. I am Dr. Freddie Gomez. Ngayon, nagsimula na po ang testing, ang targeted testing para sa COVID-19 being used. So just to note, if your symptoms are mild, you won't have to be tested, and chances are you will be sent home. COVID-19 patients can be asymptomatic. So ito po ang pag-usapan natin today as we hope to better understand this very important process. So to join us in this discussion, we have Dr. Ted Herbosa. Siya po ang medical advisor of the National Task Force or NTF ng COVID-19. Dr. Ted, thank you for joining us.
Good afternoon, Dr. Freddie, and good afternoon to all the viewers of The Doctor is In.
Yes, Dr. Ted, how different is this COVID-19 testing that we're doing now kumpara doon sa testing that we had before?
Correct. We're doing currently the PCR test or the polymerase chain reaction testing for the presence of the virus in the individuals that have symptoms. And we're trying to target about 20,000 tests a day. We are currently still testing about 2,500 individuals daily. But to have a true picture of our spread of the virus in Metro Manila and the country, we are targeting up to about 20,000 tests by May 15 and 30,000 tests a day by May 30. So this is the current direction of the National Task Force to increase testing. We're trying to do the increase in testing by increasing the capacity of our laboratories. We started with about 4 testing laboratories, RITM, San Lazaro, and the Lung Center. But now we've added several, and at present, we actually have 19 accredited testing facilities with what we call the very strict biosafety level 2 standards that is needed for a virology test. But we plan to increase this some more with inclusion of more laboratories by the Philippine National Red Cross and also the private sector hospitals that have been lining up for accreditation. As of now, we're capacitating all the regional hospitals, but we also want to get automated machines because as of now, not all are automated. The capacity for one laboratory is anywhere from 400 to 600 tests a day if it's not automated. But once machines are automated, you can ramp up to about 1,200 tests a day, which will increase our ability to test cases. Now, this is very important, Freddie, because as long as we're unable to test patients or what we call probables or suspects, they will continue to infect and transmit. So the R or the reproductive number continues to be above 1. So our target is to flatten the curve, and the idea of that is to really test as much people as we can and give the results within 24 to 48 hours so that they can be isolated and prevent them from transmitting COVID-19 to their close contacts.
Yes, we're lagging a little bit behind, but hopefully with those new testing facilities open, we'll be able to reach those targets that we hope to achieve. But Dr. Ted, what is the overall goal, or what do we wish to achieve with this new testing phase on COVID-19?
Well, the goal really is to be able to detect, trace, and isolate. So that's the part of the National Action Plan is detect, trace all contacts and then isolate them if they are positive and then treat them early on. What we've learned is that from the experiences in the other countries, the earlier you treat them, the mortality is really low. I think the one that has a lot of testing is Germany. Germany does about 150,000 tests per day. So that's the laboratory capacity of Germany in that capacity. And they didn't have to do lockdown because of their massive testing. We had to do our lockdown because we didn't have that much capacity. So we bought time with the enhanced community quarantine. We bought time and we were able to capacitate all these different laboratories in the different parts of the country. We're still slow by many standards, but we're getting there. We're trying to crunch the time, and the time given to us by this ECQ is very important, not only for establishing treatment facilities, but also ramping up the testing for all these cases.
Yeah, and one thing to note, we're doing the best. We're maximizing the facilities and the resources that we have. Now, Dr. Ted, how widespread and accessible are these new testing facilities now, or the way to be tested?
Okay, the RT-PCR, the reverse transcription polymerase chain reaction test, it's quite complex. It starts with a nasopharyngeal swab. A swab, they will take a sample of the back of your nose. They put a swab stick inside your nose and your throat. It's not very comfortable. Not all patients like it. And then it will be put in what's called a viral transport medium. The viral transport medium is then transported to the research laboratory, RITM, or other laboratories accredited, and then they will be run in batches in a machine. So usually batches of about 23 per machine, and then they run that for several hours. They split the virus, they copy it, they amplify the virus, and then they identify a segment of the RNA of that virus, and then the test will come back. Now, the delay of our testing, currently, some centers like RITM, their backlog is like 9 days. So I have a colleague doctor who tested, and he waited 9 days from the time the swab was done in his hospital. So this is because of the volume and the queue of the cases. Hopefully, with the opening of the other test centers, like the Philippine Red Cross centers, the private hospitals that are slowly being accredited, even the UP Philippine Genome Center has recently been accredited. We are increasing the areas where the samples can be sent. It's not very simple. It's a lab test. The lab has to run for several hours before the final tests are done, and then you have to check and make sure that the tests are interpreted and given back to the patients.
Okay, now let's check some of your some questions that the viewers have sent in. The first video question from Kisha Puruganan.
Like, for example, like who can be tested and how can they be tested?
Okay, as of now, the focus of the government is what we call targeted testing. It's very different from mass testing that they did in Korea or in Germany. So it's targeted testing. You have to have a contact exposure to someone with a positive case, and then after the exposure, you develop in 4 or 5 days you develop symptoms, and then based on those, the doctor will decide, as you said earlier, if you seem to be a low risk individual, like a young person, you may probably be sent home and with mild symptoms may not even be tested. But if you have other illness, diabetes, hypertension, you are elderly, you have kidney disease, if you are considered high risk, they immediately test you and would even admit you immediately in the hospital to make sure you are treated early in case you develop complications. So that's the current protocol. I would have wanted that we do really what people call mass testing. That because some of the findings in the other countries is that 50% of asymptomatic people, they have a positive test, but they don't have any symptoms. So it would be nice to capture also some of the asymptomatics. And how do I suggest doing that? We should test our frontline people, our policemen at the checkpoints, our grocery people that are manning our frontliners, our doctors, nurses who are actually exposed. They may be asymptomatic, but I want them tested as well. So that subgroup has to be tested as well because they may be the one transmitting as well, going home, policemen, our military, even government officials who visit the quarantine facilities and who are running high-ranking local chief executives may have to be tested so that we make sure that the asymptomatics do not become super spreaders.
Now, we have another question. We have another video question from Monica Corralde. Let's watch this.
Who will be prioritized for the said mass testing? Will it be the health professionals or the patients under monitoring or the patients under investigation?
Okay, we've changed our terminology now. As you know, the patients under monitoring has now been removed. We now have what we call the PUIs, which are classified into suspect and probable. You are a suspect if you have been exposed to a person that has had COVID-19. That means a close contact. Let's say your husband or your parent in the same household got a positive COVID case, and eventually you will be considered a suspect. The probable is if you are a suspect and then you start to develop sore throat, cough, fever, or what we call influenza-like illness. Once you develop influenza-like illness or severe acute respiratory symptoms, you will now be considered a probable and you need to be tested. So those are the people we target as necessary for testing. And then, of course, I mentioned I want frontliners to also be regularly tested with or without symptoms, especially on a regular period, like every 2 weeks, they should be tested if they're working in a COVID hospital or in a frontline.
Okay, now thank you very much for all that information, Dr. Ted. Now, before we go into a break, do you have a message for your viewers? Dr. Ted?
Yes, for the message, I think it's very important that people get information about COVID-19 from official sources, the government, the WHO, the CDC of the US. They provide lots of information. Some are in Filipino so that people can understand it. I think it's not important not to be scared. The government now has ramped up testing. So you coordinate with your local chief executive or your local officials in the area, the barangay, the doctors in the city, so that you can avail of the testing. They coordinate with DOH and they will point you to the proper facility or testing. So the other scary part is please don't be scared if you are quarantined. In the quarantine areas, you will also be fed, your needs will be taken care of. This is the common fear and anxiety of relatives. That's why they hide symptoms because they are afraid to be removed from their household and put in quarantine or what they think as prison. So please think that that is for everybody's welfare. And once you are in quarantine, it will prevent the transmission of COVID-19.
Okay, that was Dr. Ted Herbosa, the medical advisor of the National Task Force for COVID-19. Now, we'll be taking a short break, but when we come back, we will talk about the differences between the test kits currently available on the market. We'll be right back. And welcome back to The Doctor is In. I'm Dr. Freddie Gomez. So kanina pinag-usapan natin kung gaano kahalaga ang testing for COVID-19. Now let's see some of the key differences of the test kits used for COVID-19. So right now, I believe it is flashed on the screen, and one thing to note is on the last part for the PCR or for the antibody rapid test, that should be probably around a 85 to 90% sensitivity rate. So to discuss more about this topic, joining us right now is Dr. Rontgene Solante. He's the chairman of the Adult Infectious Disease and Tropical Medicine section at the San Lazaro Hospital. Hello and welcome to the program, Dr. Rontgene.
Hi, hello. Good afternoon.
Ngayon, Doctor, could you explain to us what should one be wary of when it comes to rapid test kits?
Okay, the rapid test kits, in comparison with the RT-PCR, it detects an antibody. Okay, so an antibody is detected if you have been exposed to the COVID-19 or if you have recovered from the COVID-19. So meaning, dalawa ang purpose niyan. Makikita natin dahil yung antibody mo will only be produced if you have been exposed during acute infection or you have an antibody that will be produced during recovery after an infection.
I see. So, doctor, does the PCR kit remain still to be the gold standard when it comes to testing for COVID-19?
Yes, the PCR is still the standard for the diagnosis of the presence of virus for patients with COVID-19.
Ngayon, doctor, we were supposed to show a table of the differences between the two kits. Unfortunately, some technical difficulties with that, no. But given there are some shortcomings when it comes to the rapid test, meaning some of the shortcomings is actually on the sensitivity of this or the accuracy of it. Is it still important, though, given those disadvantages, is it still important to have these rapid test kits done?
Yes. So first we have to know what is the disadvantage of this particular rapid antibody test kit. One is that it has it can have false negative result. Okay. Remember, when you have a COVID infection, some patients will not produce an antibody against the virus. So meaning, even if you have the infection and your antibody test is negative, that doesn't mean that if you're negative, you don't have the infection. Number two, in some patients that are immunocompromised, they will not produce enough antibody, so it cannot also be detected by the rapid antibody test. And number three, it needs timing because an antibody will only be produced during the 7th day of illness up to 14th and up to 21 days. Now, what is now the value of this antibody test in our management? It can be a complementary test to the RT-PCR. For example, if you have a patient that is clinically compatible with a COVID infection, and that part 7th day to 10th day, your RT-PCR is negative, then an antibody test, IgM positive, can be the other marker that the patient is or having an acute infection. Number two, the antibody test is also an indicator if the patient has recovered using the IgG. So in fact, that's what we're using now. One of the criteria that we want to that we're looking at if we want to discharge the patient or a particular individual whom we want to advise for return to work, then he must have developed an IgG antibody.
Okay, now, doctor, now that the ECQ has been extended until May 15, what should the public expect in the coming days?
Okay, so we would be expecting that at this point in time, if the trend of the infection remains stable, meaning the number of cases will not be significantly higher in the coming days, then hopefully in the next 15 days, we can lift the extreme community quarantine and we can now be on the general community quarantine. So it's very important for us to monitor the number of cases on a day-to-day basis in the next 2 to 3 weeks that we still have this extreme community quarantine.
Okay, now, doctor, we will flash again the table that shows the differences between the two types of kits for COVID-19. Now, doctor, no, on the last category of the chart was performance. For the PCR test, we have a 95 to 97% performance. But for the rapid test, what kind of percentage rate are we looking at?
Okay. Now, the current limitation, Freddie, of the rapid test or rapid antibody test that is available in the Philippines, it's the lateral flow assay. The lateral flow assay, compared to the other methods of antibody, rapid antibody or the other antibody tests, it is one of those that has a very low sensitivity and specificity. So what is very important here is that we should also first do a validation which among this rapid antibody test kit has a very good performance in terms of sensitivity and specificity. Why? Because not all of these rapid antibody test kits available now in the market may have the same performance in terms of sensitivity and specificity. So that is very important. We have to have a data on that. Now, after that, if it is validated and we were able to get which among the top 3, top 4 has a very good quality, then we should also recommend that these are the tests that we should be using instead of just any other rapid antibody test kit.
Okay, now let's go on to some of our video questions posted by our viewers. The first one is a video question from Vincent Mariano.
How long will the mass testing process take from having tested to getting the results?
Okay, being a rapid antibody test, yes, it will only take a few minutes. That's why it's one of the tests that we consider a point of care. You go into the hospital or the clinic, you have the test, and within 5 minutes or 10 minutes at most, no, because you have to observe for the reaction, you can have the result within that span of the time, and you don't have to wait for 24, 48 hours waiting time for the result of the rapid antibody test.
Okay, that's good information to know. Now we have another video question coming from Miss Angela Buensalida. Let's watch this.
Which is more feasible in our country and cannot be implemented in the next 3 months?
Okay, so since we really advocate the expansion of the testing capacity, okay, as much as possible, we want to identify, we want to isolate who are those really positive, and then once they will be isolated, then they have to be treated. I think the most important test here is still your RT-PCR, because what we need to isolate now are those who really have the symptoms. If you're going to use the antibody test, it should be in complementary with the RT-PCR. For example, if a patient is symptomatic and you do an antibody test, okay, and if the test in your antibody kit will be negative, that doesn't assure you that the patient is negative for COVID. You need an RT-PCR. So those are the examples why an RT-PCR is still the most important test in the next few weeks for the active surveillance of who are the patients that need to be treated and who should be isolated also.
Now, doctor, a lot of people may have been seeing these rapid tests. They liken it similar to probably like a pregnancy test, similar yung itsura nila. Can these rapid test kits be done at home? Are these self-administered kits?
Okay, this is not a self-administered kit. You need the guidance of a medical doctor to do this. One, because you also have to implement proper infection control when doing this test, okay, the disposal of the kit. Number 2, you need a medical doctor also to interpret the test.
Okay, so that's very good information. Now, before we go, doctor, do you have a message for our viewers?
Okay, so we are now on the last few phases of the extreme community quarantine, the last 3 weeks. So I hope you will still be able to continue with your activity, that you have to stay home. and help us in the control of COVID-19. And to the we continue patient, and hopefully with our steadfastness, hopefully we can stop COVID-19.
Okay, thank you very much, Dr. Solante, for clearing up a lot of things when it comes to COVID-19 testing. And thank you as well to our viewers for joining us on The Doctor Is In. And thank you all those who sent in their video questions as well. We hope we're able to answer your questions. So please tune in again tomorrow as we discuss self-care amid quarantine. And that is only here on CNN Philippines Facebook Live. So I'm Dr. Freddie Gomez. Stay home, stay safe, stay healthy.